Your genes hold the answers to your family's overall health. I'm Dr. Paula Krupstad, and on the Get to the Root with Hope for Healing podcast, I sit down with experts in genetics, functional medicine, and family care to explore what's really going on beneath the surface so you can stop guessing and start healing. From personalized insights to practical tools, we bring you whole family wellness that starts at the root. Welcome to the Get to the Root podcast. I'm your host, Dr. Paula Krupstad, and joining me today is a friend and an amazing pediatric dentist, Dr. Amy Luedemann. Amy, thank you so much for joining me today.
Thank you so much for inviting me. I'm really happy to be here.
Now, I don't want to botch this up, but Amy's credentials are really incredible. And I think one of the first things that just impressed me so much was back, 2017, 2018, we spoke for the first time, and you had founded an incredibly successful pediatric dentistry practice in the Katy, Texas area. And I know I sent several of my kiddos over there, and even as an adult, one of my adult children, my husband and I even went out and saw you later on, but a multidisciplinary clinic that had chiropractic care, a lactation consultant, an osteopathic physician that optimized airway function for infants and babies. And you took a deep dive into tongue ties, lip ties, and we're going to talk about that in a separate podcast. But you've also developed some patented type devices to help with airways. And I'm so grateful to be able to have you on. Now, what we're going to do two different types of podcasts, but the first one is hearing from a pediatric dentist what so many parents who lean toward holistic, functional medicine care want to hear about dentistry through that lens. And we're going to hear the good, the bad, the ugly, the controversial, and because there's a place for all of these things. And so let's just start there. Does that sound okay with you?
That sounds great. Yes, absolutely.
Okay, good. Well, I'd like you to unpack for us right now what the standard of dental care is as far as when a child should see the dentist and what those visits should entail.
Okay. Well, I guess I would start again. Thank you so much for this opportunity, Paul. I really appreciate it. So the towing the line, kind of what the American Dental Association, the AAPD, and all that says is that children, should come by 6 months after the first tooth erupts or 1 year of life is the first dental visit. And, the thing about that is that when you're talking about these organizations, they're doing it more from a public health standpoint. So they want children to come early because if they're going to be issues, it's great to find it early and kind of get on top of it early. In practicality, I did really like to see children early. Obviously, in my practice, I'm seeing them soon after birth if they're having issues. But, with kids without any issues, a year is a good time to see them because you're able to see my daughter, for example, when her teeth started coming in, they were missing some enamel. And if I hadn't known that, we would have been in a big situation a little bit later down the road. So, going in at 6 months to a year is a great idea. At that visit, really what we're just doing is looking at everything. We should be looking at not only the teeth, but the oral tissues. We're looking for restrictions that impact function as well as growth and development. But in my mind, those visits are really about anticipatory guidance. Obviously, little children don't really need their teeth cleaned. In my practice and as children aged, my goal was to help the children have internal motivation, to know what they're doing. We would spend a significant amount of time, like just in facilitated learning style, checking out how are they brushing their teeth? Do they even know what floss is? And have the parents close by so that they could see, like, oh, I thought he knew how to brush his teeth, and they're kind of watching them. So it's really about helping them to be empowered to take good care of their teeth. And then we would teach about nutrition and how that related to overall health in the teeth, because my bachelor's nutrition, so it's kind of important to me too. But at the end of the day, this would be controversial, I guess. We tell people to come into the dentist every 6 months, but children rarely have calculus or needs for dental cleaning. So that's not based in any real science that we should go exactly at that amount of time. That's just kind of what we've done for a long time. So it really should be based on your child. So if your child, you go to the dentist and the teeth look great, the enamel's great, and you're eating healthy, they're growing well, they're not having sleep issues, breathing issues, you could probably stretch it out and just go in periodically and check it out. That's how I manage my daughter and my nieces and my nephews, and myself. And then, yeah, X-rays is probably something else people would ask about at those visits.
Yes.
Yeah. So that's also another really controversial thing. I know it's really hard. I mean, for me as a mom and as someone who is also very holistic in my lifestyle, obviously x-rays, we only want to take them if we need them. I do like when children are probably around 4 or 5, that's when their jaws are changing. And, from assuming they're growing well, they have spaces between all their teeth when they're little. So you don't need any x-rays. You can see everything beautifully. But the first time for some children to get cavities is right in that age bracket when the 6-year molars are getting ready to come in behind the baby teeth and pushing everything tight together. And a child who's never had cavities and now they have closed contacts, it's much more common to get those type of cavities, even if they've never had them before. So those first little bite wing x-rays are kind of nice to have at that time, somewhere after the teeth are close contact. So you can see. And if again, the enamel's beautiful, the anatomy's beautiful, you don't necessarily need them all the time. The ADA and all the different people are going to say you need them at this time and this time and this time. But practically speaking, you really don't need them unless there's indications.
Mm.
Yeah. So does that help to start? I'm kind of just off the cuff.
Yes, that really helps to start. I'd like to go back to infancy and talk about chewing and mistakes that have been forced upon society using pouches.
Yes.
And so I'd like you to talk about the development of the jaw and the mouth and the palate, the way it's supposed to be. And I had this conversation with some parents yesterday because I applauded them. They said, we use real food and we didn't go down that pouch route. And I said, you guys are just making me so happy at this point in time. So I'd like you to opine on that a little bit because that is going to be conceptually probably the first time some parents that are listening to this have heard that pouches aren't the best idea.
I'm really glad you asked that question because it's really important. So, maybe 500 years ago ish, we did not need braces. We rarely had cavities. And so what's changed, of course, now we don't fit our wisdom teeth. We don't really have spaces. We have smaller jaws and smaller airways. And when I explain to parents what the airways are, if you think about it, your airway size is the width here. And it's also your airway is the space in front of your spine behind your face, behind your jaws.
Mm, mm,
So when we're not growing forward and wide as we used to from chewing real food and hard food and from extended breastfeeding, we have smaller jaws, smaller airway, more crowding, less space, all this stuff. As far as food goes, I'm not a fan of pouches, purees, puffs, melts, gummies, any of it. And I know because, in my interdisciplinary clinic and in my best friends are like speech language pathologists, osteopaths, chiropractors, so we're always having these conversations. But yeah, when we're born, obviously we're meant to nurse if we can. And I'm also really, mindful that it doesn't work for everybody. But we're talking about normal. When a mother is breastfeeding, there's like 30 muscles that are being recruited in the infant, and it's creating an entire dynamic to allow the jaw and the upper jaw, especially, to open and widen and come forward. The lower jaw as well, when we're nursing, it's moving back and forth, and that's creating growth for the lower jaw because most babies nowadays are built, and they're born and it's like, oh my God, they don't even have a lower jaw. What happened? It's so
mhm.
retrognathic. And that's a whole nother topic about airway and things like that, but with the mom. But anyway, so when we're nursing, the baby is so much more is happening with muscle recruitment, with growth and development, with allowing the jaw to move forward. When we have a bottle, it's kind of flat and that lower jaw doesn't really get that same movement. And we're creating more force. There's very little muscle recruitment of the whole baby involved. And we're creating forces that collapse the palate even more around that nipple. But fortunately, there's a lot of things we can do to help when that's what's needed. And then as we move into when the teeth are erupting and the baby's able to have some core stability, hold their head up, that's the sign they're ready to eat. And if we give them pouches and purees and puffs and melts, they're still using the suck reflex. They're actually not learning the next stage of development for chewing and that sort of stuff. And then the actual force of chewing appropriate foods. And I'm not an expert. I know my daughter's first food was an apple, but when they are not getting the opportunity to chew the foods, it's also creating less muscle development, and form follows function. So when you actually use your muscles to chew the way you're meant to, and the hardness of the food that you're meant to chew from a young age, you're actually developing muscles of the jaw, which is developing more density of the jaw and creating more growth of the jaws. So not having puffs, melts and purees and all that stuff, which keeps that suck reflex going, gives kids more chance for forward tongue thrust and altered swallow patterns as they grow. There are just so many different things. We also, when we first are babies and we don't have any teeth, that's one pattern. When the front teeth come in, that creates the first stop, and it's a neurological change as well. And the swallow pattern changes. Then when the first molars come in, that creates a boundary, the first boundary for the back part of the tongue, and things should shift again. So all of these parts are really important. And if we're not giving the children what they need at those different stages, there's going to be consequences that, you know, very significant in some kids, and it's kind of normalized. I mean, there's a lot of people walking around that, don't really find their way into an SLP's office. But if you sat across from them when they're eating their meal, you might think that they would benefit from a little bit of help.
So, can you tell our listening audience what an SLP is?
Sorry, speech language pathologist. So
Yes,
yeah,
yes.
someone.
Thank you.
And like we were gonna, I think, mention, there's speech language pathologists, and there are also some that are more trained in what's called myofunctional therapy. And not all have that same training, but that's something I think we'll talk about more when we get to another time.
Yes. Yes. I really I just learned so much from you just breaking that down as far as the changes when the first teeth come in and then the boundary with the molars and what's happening neurologically. I remember when you gave me an illustration, just think about, pioneers going across America in a stagecoach and they would give their child a piece of hard jerky to chew on. And that imprinted in my mind, and I think about all the falsehoods that were ingrained into my mind as a board-certified pediatrician and through the years, and then what is thrust upon society for convenience, and so much appreciated. Now, I would like you, as a pediatric dentist, to tell me how bad goldfish is.
Oh my god. And nutritious. Like, I mean, do we even need to go there? This is a thing for me. When I see families, I really like to meet them where they are, because if I told you where I came from in life, a phobic dental patient, I don't even think I knew what floss was until I became a dental assistant at 18. So I came from like not knowing anything. And it was just beautiful people and mentors along the way that helped me. So when a family walks through the door, I don't, their kid has cavities. Okay, let's just figure it out. What's going on? So with that, if they're, and from a dietary and nutrition standpoint, when I was at college studying that, if someone was presented to you as a dietitian with heart, problems and needed to change their diet, you didn't just hand them a diet. This is what you should eat. You asked them to tell you what you do on a regular basis. What's a couple of weekdays like? What's a weekend day like? And that's how I like to approach my families, because then we can take where they are and make enough little shifts it's going to be impactful, but still, not like just throw everything out the window and they're going to feel deprived or whatever. So with goldfish, my starting point is, if your child's going to have goldfish and juice for a snack, which is like what everybody's eating all over the place and all those, places where kids are, of course it's processed food. So both of those things are just a high sugar, hit right off the bat. And those sugar and processed foods, it's not just about, like, goldfish aren't as sticky in some ways as some fruit snacks, but they do really stick to the teeth. If you look at someone that's eaten that and look a little while later, that processed goldfish stuff sticks to the teeth for a long time. It's not just that sugar and processed food that affects directly the teeth, it impacts your immune system for a couple of hours. And your immune system is an important part of fighting cavities. It's not just what's touching the teeth. But as far as what's touching the teeth, when you eat or drink something, anything besides maybe a piece of meat that has no carbohydrate, but pretty much when we eat or drink, our mouth is the place where digestion starts, and it starts by lowering the pH. And in that lowered pH state, minerals leach out of the teeth in that acidic environment. That's just part of it. And we're processing the food. And then after all the food and the drink is off of your teeth, your pH goes back up. And, if you're healthy, your saliva has minerals in it and it remineralizes the teeth. So the trick is this: when you're eating goldfish and juice and gummies and things that stick on the teeth, your recovery time for the saliva to rebuild is diminished because sometimes it's an hour later and there's still some of that food stuck in there. So the pH, all of that time is just pulling minerals out of the teeth. So that comes with grazing and sticky foods. They're just constantly, I usually draw a graph for parent. Here's the line, you know, demineralization, cavity prone here, remineralization, repair here. So if you eat and it's a sticky food and you're down here for a long time, and finally when you get up here, it's like, I want another bite. Well, you barely had any time in repair and you're down again for a long time. So this is where those types of foods come in, not to mention the food coloring, all the things that aren't really even food in them and what they do to us from an inflammation standpoint and all that. So what I usually tell families, if you're going to have goldfish and juice, a simple thing that you can do is have your kids agree before these kinds of snacks that they're going to finish with a little bit of crisp fruits or vegetables and a little quarter cup of water. So like 3 apple slices and a little bit of water. We do like a little fun experiment, or we did in my practice, where we would dip a butter knife into icing and let the kids, you can do all sorts of different things with it. Brush it with a dry brush to see how it smears it. Brush it with toothpaste to see how toothpaste is an emulsifier and kind of cleans it a little bit. But ultimately, we would cut the knife through an apple one time and it would come off super clean. And that helped the kids to visually see eating cucumbers, apples, things like that gets that sticky stuff like the icing, which is the plaque and the sticky food, off of your teeth. So finishing with that and then a little water to more quickly bounce you back up to that repair is a great idea. And then little by little, maybe switch the goldfish for something that's like goldfish, but we're first getting rid of the food colors and, some of the other ingredients in goldfish. Yeah, that's kind of where I go with that. Did
Yeah.
I answer the question?
Absolutely. So that is a great little lateral shift. I love what you said about meeting people where they are. We have good, better, and best, and none of us, these changes have to be made slowly. It's all about creating a sanctuary of healing in your home. And it starts with mom and dad. And the illustration that you gave about putting that sticky frosting coated knife through an apple, I think that's a brilliant thing that we're going to start incorporating into what we talk to parents about too, because I take care of so many special needs kids that they eat white bread, peanut butter and jelly, goldfish, hot dogs, macaroni and cheese, and the whiter the bread, the quicker you're dead. It's so ultra processed and all these things. And it's all about one thing at a time. So that's fantastic. So I learned that. Now, one of the other questions I had for you, and this is where we'll take a little bit more of a deep dive when we go into airway and breastfeeding. What words of consolation would you give to a mom and a couple who have not been able to breastfeed and they're bottle feeding? And it is what it is. I'm reflecting back on the one out of my 4 children that I did not breastfeed, and I have these regrets, but I can't live there. It's what happened, and we learn as time goes by. But what do you say to parents if their child comes in at a year and a half? You can probably tell there's some things in the airway and their mouth, and you find out that they've been bottle fed instead of breastfed. What words of consolation do you give to the
Yeah, I appreciate that. And, really, I probably wouldn't say anything unless she wanted some words of consolation. But
Yes.
a couple things. One is I was bottle fed and I'm okay. I turned out
Yes.
okay.
Yes. So was I.
Yeah. And, I also, breastfeeding was really important to me in my journey with my daughter, who I had later in life. And it was really painful and really hard. And I had like all the best people around me. Like I had my osteopath, Dr. Judy, come to my house, like when my baby was just barely there, but it was still hard. And so, yeah, I would just say be compassionate with yourself. If you have the intention to do it and you do what is in not everybody can even have an osteopath or a lactation consultant. I've been in the habit of giving friends a lactation visit when for their baby shower gift. So I'm like, this is your present, no matter what do you think you need it or not. But if you weren't able to, then that's just the way it is. You weren't able to. There are other things that are really important that I don't think moms know sometimes, and this may be a little bit going off topic. I mean, I guess what I would say is it's okay. Like, especially in my hands, in my practice, we can make that child grow just like they had the breastfeeding and the hard foods. We can get back to where we needed to because everybody has everything they need inside of themselves from the time of conception to be their best self. And as you and I think both practice, our role as a health care provider is to recognize and remove obstacles and to enrich the environment where they're lacking what was meant for them to have in the soil or whatever else. So it's okay, is what I would say. But also, when you're bottle feeding and breastfeeding, another kind of like side topic is just that one of the things that we're meant to do as humans and parents that we're not doing a very good job of, in my mind, is to help our babies learn to transition from one nervous system state to the next. And
Mhm.
breastfeeding is one of the very first times we get that opportunity. So when the baby latches on, ideally, all of these hormones are released in mom. So baby starts mobilized, sympathetic, crying, upset, they're in sympathetic and that leads mom to latch them on and they feed. And then once they latch on, then all of this stuff happens. And hopefully, mommy and baby and go into this new state and baby learns that transition. But nowadays, sometimes moms are on Facebook and they're angry and frustrated. They're detached and doing something else. They're maybe working because they need to work from home at the same time. There's all these. And so, mom's not transitioning. So, baby's not learning transitioning. That can end up with we think our baby has reflux or we think our baby has all these other issues, but they're eating in sympathetic and they're not learning these transition states. So the reason I bring that up is that even if you're bottle feeding or whatever you're needing to do, like remembering that like I need to be connected with my baby during this time, paying attention to what's happening inside of me because your baby is just this little tiny mirror of you at that stage, so neurologically immature. And so I think there's still so much you can do to help your baby grow healthy, to be healthy, and for yourself by, even if you're not breastfeeding, to really honor, what's happening in that space. And they're going to be okay, is what I would ultimately say. And yeah.
Fagron Genomics for sponsoring our podcast. Without knowing what your precision genetics are, you don't have a roadmap. So please log on to our website, schedule a welcome call, and see what the Wellness Blueprint can do for you. That's the premier and proprietary genetic panel that Fagron has allowed us to create. I really like where you went with that because for a mom to realize that this is her opportunity to move, like you said, from sympathetic overdrive, a hungry, starving baby, to parasympathetic, rest and digest. Take that time to look at your baby, talk to them while they're latched on. And
Or
I remember, what was that?
with a bottle.
Yes, yes, exactly. Yes. And just make the best of it. And whatever situation that you're in, and there's grace there. Now, the two things I wanted to ask before we wrap up, just routine dental things to explore. The first thing I wanted to ask you is toothpaste. What are your thoughts on toothpaste and the types, depending upon whether or not a child has adequate enamel versus not adequate enamel? And then we'll talk about fluoride.
Well, I mean, just again, I kind of mentioned it earlier. Toothpaste is an emulsifier, and if you think about when you make a baked spaghetti dish, and then you need to clean it, if you just try with hot water and a sponge, it's going to be a really laborious situation. So having dish soap is emulsifier and breaks up the fats and the stuff that's stuck onto the pan. And likewise, our biofilm and the germs and the bacteria that we're trying to wash off it needs an emulsifier to come off if you're using we're talking about brushing your teeth, but also apples and other things. If you just take time to notice after you eat an apple how clean your teeth feel. So anyway, so toothpaste is an emulsifier. I think if your child is swallowing toothpaste, then you should definitely not be giving them something that has things we should be swallowing, like fluoride. And yeah, just pick whatever flavor they like. It doesn't really matter. I mean, I know the ADA puts their stamps on some, but at the end of the day, as long as it has safe ingredients and the child likes the flavor and it's safe for them to swallow. I mean, my daughter and I, we use a hydroxyapatite toothpaste because hydroxyapatite is what your enamel's made out of. So can't be bad.
Yep,
Yeah,
right here, my desk drawer.
yeah, so, I mean, it's just getting something in there. Again, I just can't emphasize enough well, I can. So, we think of fluoride and we think of toothbrushing and flossing as, like, super important to fight dental disease, but the truth is if there was a hierarchy, diet is here. What you put in your mouth and eat is like right here as far as preventing cavities, gum disease, helping with growth and development. When you're talking about brushing and flossing and what toothpaste you choose, it's like way down here. And you could do an experiment, like go ahead and eat some crackers, some whatever things that you know you shouldn't, but you like to. Feel how your teeth feel afterwards in the next hour, a couple of hours. You can like lick them, drink water, whatever, feel that. And then eat fresh fruit, crisp, raw fruit or vegetables, and feel how clean it feels afterwards and kind of compare that to toothbrushing. So, toothbrushing is something that we do to help mitigate the effects of eating stuff we should not be eating in the first place. Yeah.
I like that idea. Go ahead. Go.
No, that was pretty much it.
And
I don't really say this a lot, but when Evelyn, my daughter, was young, that we nursed until her 5th birthday. I know that's a long time, and I never planned on it. That's just kind of what happened, but she's so, so healthy. But I rarely brushed her teeth early on. I mean, she did not have sugar or processed foods till she was 3. So, I'd look at her teeth and I'd get in there to get her used to the idea, but there just wasn't plaque on her teeth. And so and another thing that we didn't mention is breastfeeding at nighttime gets a lot of, like, oh, you're going to cause cavities. Breast milk by itself doesn't cause cavities. It's not until you introduce processed foods and cavities begin that the breast milk can feed into the already forming cavities. So, anyway, side note, but that's cleaning and toothpaste.
the pr the beautiful protective effects of the perfect food that God made for feeding our babies and our children is breast milk and all the beautiful things in there and closing up a leaky gut. All right. The other thing is, I'm just going to bring this up is that here, one of the things that we frame a lot of things with is looking at precision genetics. And that's actually who sponsors our podcast. And we identify children who have profound inflammatory risk, but diet trumps so much. The families that put quality, beautiful phytonutrients, colors of the rainbow into their child's mouth, they are at so much less risk for dysfunction and illness, especially environmentally too, if they're living in a really clean home also where their immune system isn't being attacked all the time. And what are your thoughts on fluoride in general as compared to the American Dental Association?
Yeah. So I assume everybody knows what, again, the American Dental Association and the American Academy of Pediatric Dentistry. Also, remember that comes from public health. So they're looking at the whole population and trying to make recommendations. But as an individual provider, you get to sit with your patients and see what their risk is. And what I would tell families when they were asking me, about fluoride, because we had established trust and they want to know if they should have it for their kids, this is me personally speaking, I think of fluoride as like Excedrin. I don't really take medicine, but if I had like a massive headache, because in the past, I would have some sometimes, and I took Excedrin, it was gone. Even though I know now it wipes out my glutathione, it's like a terrible thing for me. But it's like if I had to work, it's like a drug. I'm going to take it. It's going to take care of it, and I'll manage the effects. So fluoride for me is like that. If I have a child coming in and they have a mouthful of cavities and they're very high risk, I want to keep them out of the OR. I want to get them back to a baseline because my research and residency was about 0 to 5 year olds and all the different effects when they have cavities, like lower ideal body weight, cognitive, all these other things. So I might use fluoride like I would Excedrin. Let's just try right now to put the fire out. And then once we have the fire out and we're leaning them back, we're kind of patching things up with things that don't require a lot of isolation or technical difficulty and get this kid stabilized. And those frequent little short visits, doing things like that helps the kid to have trust and so forth. So for me, fluoride in a situation like that, I would use fluoride. But I tell because it's important to know the topical application of fluoride actually makes the outer layer of the enamel fluoroapatite, which has a tighter crystal structure. So it can have a lower acid attack for a longer period of time before it dissolves. So, topically speaking, in a situation where they're eating goldfish and they're drinking juice, it's kind of like, where do I start? Well, I want to start with putting the fire out and talking about what's going on. It's not just let me fluoride you as much as possible and use a strong fluoride toothpaste at home. Let's just keep fluoriding you to death because that's not going to make a difference if we don't talk about the goldfish and the juice. So we might
Yes.
use it in that interim situation to get things stable, to get the kid comfortable while we're addressing this other thing. Because my goal is that you don't need me ultimately. And as far as home fluoride, our in my personal home, like we don't use fluoride. We filter it out of our water and we use free toothpaste. And I think that that needs to be a decision that you have with your family and your dentist and based on your risk factor and what's going on in your life. But yeah, that's kind of how I see it. That's not the towing the line of what the ADA, AAPD say though.
Correct. And how you framed it when we think of public health and what the motivation was when these standards were put forth. But then as time has gone by, we've learned how, it's a neurotoxin. And as a halogen, it type of an element that it can replace iodine in the thyroid, and then you can develop all kinds of other issues. So I really appreciate the balanced perspective and meeting people where they are. All right. Well, Dr. Amy Luedemann, thank you so much as a pediatric dentist with a holistic and functional twist, explaining for the listening audience the somewhat altered anticipatory guidance and dental care and that you've offered to our listening audience. But I especially appreciate hearing about eating that apple or that cucumber after you've eaten something sticky and gooey, and how if you can take the acidity out of the mouth so that the teeth can remineralize. It just goes to show that our bodies are meant to live in this beautiful pH range. And if we're too acidic, we die. If we're too alkaline, we die. And there's ways to color within the lines that are healthy. And our food and our diet, food is medicine. And as you said, your degree was initially undergrad nutrition, and then how that benefits the pediatric dentistry. So, all right. Well, thank you so much. Thanks for joining us at Get to the Root with Hope for Healing. If this episode helped you, follow and share it with someone who needs it, and leave a review. It helps others find us too. For a free consultation, visit our website at gettotheroot.com with the number 2 and schedule a welcome call. We'll see you soon.